It is just a huge honor for me today to be podcast interviewing Kerry Maguire DDS, MSPH, Associate Clinical Investigator and Vice President for Clinical Operations at the Forsyth Institute in Cambridge, Massachusetts. She serves as the Director of ForsythKids, a community-based prevention program serving over 2,500 children in 60 sites throughout Massachusetts. Dr. Maguire holds adjunct faculty positions at Harvard School of Dental Medicine and the University of Washington School of Dentistry. She is also co-founder and chair of the nonprofit Options for Children in Zambia at optionsforchildren.org. Dr. Maguire completed her dental degree at the University of Colorado School of Dentistry in 1988 and earned a certificate in advanced education in general dentistry the following year. In 93, she received a Master's of Science in Public Health from the University of Colorado School of Medicine. She has experience in dental education and industry, having previously held positions at the University of Colorado School of Dentistry, Colgate Oral Pharmaceuticals, Tufts University School of Dentistry, Tom's of Maine. She is a general dentist representative on the American Academy of Pediatric Dentistry Board of Trustees. She serves as chair of the Better Oral Health for Massachusetts Coalition and is a gubernatorial appointee to the Board of Children's Trust, the Commonwealth's private-public partnership to stop child abuse. She's an active in the American Association of Public Health Dentistry and other national and international organizations dedicated to oral health and success. Her professional career has focused on oral health access for vulnerable children and other populations, applied interventions, community advocacy, workforce innovations, and sustainable systems promoting oral health. You have more on your resume than me and all my listeners combined. It is just a huge honor to podcast you today. My first question has got to be, are you related to that Jerry Maguire guy? I saw the movie.
Well, I wish I was. I think I would be richer. But I did have a very good run in having both my first name and my last name spelled correctly while Jerry Maguire was popular.
So where does all this ambition come from? You haven't left any stone unturned. Were you just not sleep, or what is the how do you do everything that you did?
I don't know. I think dentistry is full of people like you, like me, who are passionate about what they do and find a lot of different ways to do it.
Well, I'm going to blame all your success on my favorite teacher at UMKC was Denise Kassenbaum, who is now the dean of where you went to dental school. So I'm going to blame all of your success on Denise Kassenbaum. Can I just say that for the record?
Well, you can say that. And actually, Denise gave me some very good advice because she came as an assistant professor when I was a senior dental student. And I was considering that perhaps full-time private practice was not really what I wanted to do. I was interested in research, and I was also interested in teaching. And she said to me, "That's okay. The sort of mantra throughout dental school is that you are going to graduate, you're going to go into practice, and you're going to have, a busy and successful community practice for the rest of your life, your professional life. And certainly that, I think, is a very noble ambition. But it wasn't the ambition that she had for herself. And she made me feel comfortable about the fact that I might want to play my career out in a different way as well.
She was so cerebral at UMKC. I mean, you could ask an instructor a lot of times and get a joke. You asked her, you got to answer with footnotes. She was a very intense, genius person. The ADA just recognized another specialty, so we have 10 now. And it seems like in dentistry, all the specialists like oral surgery and implants and all these things get all the attention, but public health dentistry is a specialty, and I always felt it gets the least amount of attention. It's like a mom and dad of dentistry had 10 kids, and the one that didn't get any, I guess it was the middle child. But why do you think public health is not talked about as much as ortho, endo, perio, pedo, on and on and on? Why is public health not just the focus? I mean, we're trying to manage 8 billion humans living on the surface of a rock, and you gotta look at it as the whole herd. But people start running into, oh, well, this one needs a root canal, this one needs a crown, this one needs a filling. How do you see public health in your mind?
I do believe that public health, all public health, not just dental public health, has kind of an image problem. And the reason why is that if you're doing it right, it's invisible. So, clean water, right? Turn on the tap, the safe, clean water comes out. You don't stop to think, unless you've recently visited, Africa or some places in South America or other developing countries, that this is not the norm. And I do think that public health done right kind of disappears into the background. We have to keep putting it forward in order to keep it in the front of people's minds. I also feel like you have to do both. You have to treat the individual as well as the population. And so when we talk about, the orthodontic procedure that needs to be done or the tooth that needs to be extracted, we're talking about what an individual patient needs. And that needs to be taken care of. At the same time, this parallel path of prevention and public health have to be running alongside. So I do think, it's easier because it tends to be more immediate what the patient needs and what the specialty is there to provide. But I feel strongly that obviously public health needs to be right there alongside.
What would you say that we're doing? What do you think we're doing right now or have done that's the best in public health? And where do you think, what's our strength and where do you think we're weakest? What did we do that was right, was the most right? And what are we doing right now that's the most wrong? Where do you think we should be focusing?
Well, arguably, community water fluoridation is what we have done the rightest, I would say. I'm disappointed that we have kind of run up against the kind of a wall in the implementation around the country. And of course, so it varies a lot from state to state. I think that's where we missed an opportunity, and that was, I think, a little bit before my time. But if there had been a little more push right there at the beginning, I think we would be in better shape now. And we use up a lot of time and energy, other resources in kind of battling the arguments around community water fluoridation. And I have to think too, a lot of the folks who find that controversial are also folks who are not accepting of other major public health achievements like vaccination. So that's a tough one. We got off to a great start and then we kind of hit the wall. I also feel like, and this is what takes me back to what I do every day, is that providing care for children early in life and making sure that they are looped into the dental delivery system is a very important move. And I think that there are new avenues for doing that, including partnering more closely with our pediatrician and other medical provider friends and colleagues. And but once they get to school, the importance of actually placing sealants, that's still a wildly underutilized preventive procedure that is, I think, overlooked in many ways.
I love your genius correlation that the water fluoridation is the same with the vaccination, and it's just a loss of trust. I mean, everybody's feeling it from social media to their family. We had a family get together on Sunday, and there's, I have people in my own family that think vaccinations is a plot. The Centers for Disease Control is a shill for the pharmaceutical industry, and there's just a huge lack of trust. And I have to say it, I'm 56 years old, 4 kids, 5 grandkids, and I think the biggest observation I've made in my life is that trust has been slowly drifting down. Trust in our institutions, and I don't know what it's all about or if it'll swing back, but like I fluoridated Phoenix. I was on the team doing that here in '89, then 20 years later, and 1 in 4 people from Arizona, they completely thought that it was so toxic there was nowhere you could put it. So the government bribes the politicians because they poured into the water supply because it's so toxic it couldn't go anywhere else. And you're just like, dude, this sounds like a Disney movie or Halloween 3. It's a cognitive dissonance from reality to think that someone like you who goes to all these fancy schools up by Cambridge and Forsyth and all that stuff knows less than their 15-minute Google search. I mean, it's just a bizarre deal. And I just read that study that came out today that when they iodize salt to get rid of goiter, and now those populations are all showing significantly higher IQs. So it's showing that a vaccine, nutrition to prevent goiter, obviously that nutrition affected the brain because their populations are better, and how gosh, it's just so frustrating to watch. Who do you think are our most vulnerable dental patients in America?
Well, I've always felt that children are kind of at the end of a very long game of crack the whip when it comes to who they have to rely upon to help get them into the medical and dental system. And the Forsyth Kids program, we know that children who live in low-income communities and communities of color tend to have a higher risk and rate of dental disease, particularly caries. We look for communities that have over 50% free and reduced lunch rate. We know that those are the folks that we want to connect with as quickly as possible.
Have over 50% what?
Free and reduced lunch rate.
Okay, so you're looking for populations of kids that get half their lunch subsidized.
Yes.
And what does that and what does that tell you about those kids if they're getting half or all their lunch subsidized?
That they're probably from a low-income family. And, one of the social determinants of oral health is your family's economic status. So getting to those kids and getting to them as early as possible is one of the goals we have. Now, Forsyth Kids started as a school-based program, like many programs did 20 years ago. But we also know that to sit down and look in a kindergartner's mouth and see a mouthful of cavities, it's like we're here 4 years too late, folks. So making sure that we also partner with early childhood education centers, infant toddler programs, even to work with WIC and some of the other parent-baby programs. That's where we really need to be. By the time they get to school, it's good that they have the backup of a school-based program there, but we're really going to lay the groundwork for good oral health before they get to school.
I always find it, I love my country, but I've lectured to dentists in 50 countries. It's so amazing how these things are so obvious to like the 20 most developed countries on earth. And yet America, it's still so controversial and emotional. And it's just like, even amongst the dentists with 9 years, 10 years of college out there, doing it all day, every day, they still just don't see. It was Winston Churchill that said, if all your people are uneducated and sick, how are you going to build a great country? When I go into these prisons and talk to my Arizona prison dentist buddies, they say everybody in prison has 3 things in common. They grew up below the poverty line, they didn't finish 12th grade, and they're abusing some substance. And it's like, those are all fixable things. And you'd rather just fix it by throwing them in a cage for $30,000 to $50,000 a year. I mean, who would think that was a good idea? So the biggest thing now that's the most controversial about children on Dental Town, I didn't think I'd live long enough to see a controversy with pediatric dentists. You know, most of the controversies are an occlusion or TMJ or something else. The pediatric dentists are very emotional about silver-diamine fluoride. How do you view silver-diamine fluoride? Is that a trigger word for you? Do you like it? Where do you think that's going?
We're in the process of incorporating that into our school-based program. And the sort of the joke around within portable and mobile dental provider circles is, you've seen one portable dental program, you've seen one portable dental program. Here in Massachusetts, we have a number of institutions like Tufts and BU, and also the state has a sealant program, as well as ForsythKids. We're the rather large institutional school and community-based programs. But we also have public health dental hygienists who are licensed to practice independently in high-need areas, primarily schools and nursing homes. So everybody approaches it a little differently. ForsythKids is very, I would say we're very persnickety about about how we approach the care of our children. We actually see our kids 3 or 4 times a year. And 2 of those visits at the beginning and at the end of the school year involve a dentist examining the child. So we have a full team, including a dentist, dental hygienist, and dental assistants. We very much take our role as preventive providers, especially when it comes to sealants and the application of fluoride varnish, seriously. But we also we're not a screen and release program. When we see a child who has active decay, we are very aggressive about making sure that child gets into a dental home for more comprehensive care. And I think that silver-diamine fluoride buys you some time between when you have them there in the chair in the school and when they can actually get into the office. And we all know there can be a great deal of variability in how quickly, the system, the parents, the clinic, all those pieces, like I said, the game of crack the whip, it has to work to the benefit of the child. And it doesn't always happen as quickly as possible. I think silver-diamine fluoride buys you that time. I think where it's misunderstood is that, and I'm not saying that my pediatric dentist colleagues are the ones who are doing that, but it's not a restorative procedure. It doesn't restore function. So you can't just paint it on and forget about it. It is an interim step. And I think it is one that can be used judiciously, but you don't just paint it on and let the kid go.
I want to, you actually are from the Forsyth Institute. I mean, it's one of the most prestigious independent not-for-profit institutions founded in 1910. But the Forsyth family made their money in vulcanized rubber. And that is what turned dentures around. George Washington had several sets made. He left the country when he was the president trying to get a fitting denture, but it was actually the vulcanized rubber where they started, they had this pot and they would vulcanize it. So you'd go make your horrible, ill-fitting denture made out of wood or ivory or whatever, and then they'd heat up that vulcanized rubber and they'd set it, and then it cooled, and it was the first successful denture. Is there any of that vulcanized rubber denture connection to Forsyth since they made their money in rubber? Or do you know?
Well, I haven't seen any, antique dentures sitting around the office, if that's what you mean. But no, we're very, very proud and grateful to the Forsyth family. You know, there were 4 brothers and a sister, and there were 2 brothers who wanted to honor a brother who had just passed, and that's how one of them was speaking to his dentist, and the dentist said, you know, you really want to make a difference in the world, in the city of Boston. You know, we need an institution that will care for these children and this epidemic of dental disease that we have. And so, you know, they opened the institute, and a few years later, we had the second dental hygiene school in the United States open. I mean, the connection to prevention and also to systemic health was there right from the beginning. So in some ways, you know, Forsyth not only, I think, defined much of dentistry in the 20th century, you know, we're sort of on the forefront in the 21st century too. We're coming full circle in terms of that systemic connection.
Well, you guys have won that horse race in dental history by several lengths. I mean, you guys identified, going back a century, you guys identified the 2 most common global infectious diseases, dental decay and gum disease, identified the protective mechanism of fluoride, named the oral sites for the Human Microbiome Project. I mean, you guys, I mean, talk about... I wish when you accepted my invitation to come on the show, I figured you must not have ever heard of it or knew who you were talking to, because I certainly didn't think you were going to come on the show. I mean, it's just an amazing institute. So, on your historical timeline of all the achievements, these are all long-term goals. Where do you see the research going now?
Well, I do think that you know, Forsyth is particularly strong in the oral microbiome. And of course, back in the heyday of the taxidermy around periodontal disease, a lot of the microbes that are associated with periodontal disease were discovered there at the Forsyth. So I think now, you know, the microbiome, the human oral microbiome database that we have there is something that is a national treasure, really, when it comes to science and especially oral science. And I do think that the research that's being done in the interaction between microbes in the mouth, you know, the 700 species that live there, is really going to tell us a lot about how we function as humans. And of course, you know, the mouth is one location in this long, you know, what I heard somebody say, oh, you know, humans are just tubes from gums to bums, you know, and but that environment starts right there in the mouth. And so the ability to study it and the ability to kind of rub elbows and with some of the scientists that I get to work with every day it's pretty impressive. It humbles me, let me tell you.
And what's so, you know, humans always focus on what they know, but they never stop to pause to think that possibly there's something they don't know. And that 100 or 1,000 years we may look silly, but I'm reading that they're discovering a new species of life in the mouth about every quarter. So when someone says, oh, this, you know, this absolutely doesn't do this or does that, it's like, dude, they're discovering 4 species a year in your mouth. It's quite possible that when this whole gut microbiome from your mouth to your gut is going to change how we view everything we believe today.
Sure, it's entirely possible. And so that's very exciting to like I said, to hang out with the folks who are making that happen. Dr. Wen Shi, who's our CEO and Chief Scientific Officer, and Floyd Dewhurst, Gary Borsi, they're so well recognized in their fields, and it's an honor to work with them.
Yeah. So the gut microbiome is what you're excited about. You said you guys are still analyzing the silver diamine fluoride. You don't really know where you're going to stand yet on that?
Oh, no, we're definitely incorporating it into our Forsyth Kids school-based program. But again, we see that, we see it as an interim step in the journey to care, to comprehensive care. And that's where, it buys us time. It's definitely useful. So for example, probably one of the populations that will benefit the most that we see are young adults and older teenagers who have come here without their parents from the, Central America primarily. So unaccompanied minors. And these folks, often they're 16, 17 years old. They've never seen a dentist before. When we sit down with them, we're just trying to buy them some time until we can get them into more comprehensive care. So starting with what we've got, and silver diamine fluoride is certainly one of those things. That's a very important place for us to sort of, arrest what's going on, arrest the process while you work with the system to get the care that the child needs.
Considering how long, the Forsyth Institute, how old is it? It's over 100 years, right?
Yes.
Over 100 years. It seems like we're still fighting that, the difference between dentists and MDs, where people they are not associating dentistry as part of healthcare. Look at Medicare. Medicare doesn't cover dentistry. The mouth's not connected. You and I both know 50 million school days are lost each year from children that their mouth hurts so bad they can't go to school. And in Arizona, where I live, 8.5% of all emergency room visits are odontogenic in origin. So how do you think going forward that the Medicare, Medicaid, MD community will realize someday that the mouth could be part of the body, and how does it how do we drive down that being 8.5% out of every 100 reasons to go up to emergency room? How do you approach those problems?
Well, that's the $900,000 question. I think one way to do it, and I think that even some of our colleagues that we've already talked about, Denise Kasselbaum at the University of Colorado, at Harvard School of Dental Medicine. The collaborative education between the dental and the medical students, and nursing, and PT, and pharmacy. I think that there was a little blip in that kind of interdisciplinary education and practice back in the early 90s. But now I think it's really kind of dug in. And I love that it's happening. I know that they're very passionate about making sure that the dental and medical providers and professionals work together. I think where the challenge comes in is when you get out into practice and the system doesn't support, that natural bringing together of care for the patient. That's where you really have to work at it. And I think that's, what will happen eventually, I believe, is that professionals will feel this is a great way to take care of patients, and we got to find a way to make it happen in real life, not just in education.
So I'll tell you embarrassing things. When I went back to school after I was dentist 10 years to get my MBA because I wanted to understand the business better. And it was just so sad. I was in a class of 200 listening to people from hospitals saying, well, we get $100,000 for a bypass and we get $50 for an exam. So for us to break even, we have to do 3 bypasses a day. And I thought to myself, how horrible. And now here we are in silver diamine fluoride. I've heard this conversation a dozen times where kids say, I graduated $400,000 student loans. A pulpotomy and a chrome steel crown on a child is this much money. And painting SDF on it, what will I get? $15? I won't even be able to pay my student loan indebtedness. So money money or incentives matter. I mean, we're not going to find any economist who says incentives don't matter. So I think, what are your views on that? I mean, do you think Medicaid, Medicare, insurance companies will get smarter in the future, knowing that maybe you shouldn't give so much for a bypass and you should give a little more for preventative public health? Do you think that's the direction we're going?
I would like to think that. I think you hit the nail on the head. The incentives for prevention are just not as great as they are for other, and unfortunately, there's still plenty to treat, right? So it's not like we're ignoring prevention. It's that it's not keeping pace with the development of disease. I do think it'll ultimately be the payers who light on this, and the Medicaid, the states that are responsible for providing care for kids. That's the thing I'm most familiar with, of course. Is if we can get to them and really show the cost savings, there has to be a pinch where there's a shift. But if we can show that and really prove where prevention pays, I think we'll get some traction. That's it's really a tough one.
So who in your mind is the big players in public health? I mean, is it the FHQ? Is that a big part of it? I mean, when you think of big public health, dental, government institutions providing care, who comes to your mind first? Is it FQHC?
Well, certainly that's the backbone of the FQHCs, the community health centers, are certainly the backbone. They're the safety net that we do have. We know that that's inadequate. I mean, they don't have the capacity to care for all the patients who need them. And you could have your foot on the rheostat 24/7, and it still wouldn't, you wouldn't be able to plow through all the disease that's out there. So I think that they're an important part of the system. I think that they are understaffed and kind of underbuilt. And so that's one thing. I think about the Medicaid providers or the insurers around the country. DentaQuest comes to mind. They have a lot of spread. They have a declared passion for preventive dentistry. I hope that will make a difference, because I do think that they have the clout to actually make a change and make a difference. So that, that's not maybe your traditional public health institution that comes to mind, but it's part of the system that is very important to providing care for Medicaid populations.
And do you think public health, who do you think needs more public health? Do you think it's more urban or rural?
Well, I mean, rural health was that was my first love, which when I was in dental school, I worked in the migrant health program in Colorado. And that has always been, a passion of mine. Certainly the concentration of people points to urban centers. But I think rural health is a huge issue. And I've always thought that, the challenges of providing care spread out. I mean, for example, there are many places in the U.S. where the concentration of dental providers is quite adequate, but we know that there are vast areas in the United States that are basically considered dental deserts. How do you even that out? It's a tough one.
And do you think moving forward, do you think mobile dentistry, you mentioned it earlier when we started talking, do you think mobile dentistry is going to be more of a thing, is a bigger part of the solution, or not really?
I do think it can be. I think the solution that we really need to be looking for is the multiple access points and sort of entry into the system. Whether that's a mobile program to get you started, kind of a hub and spoke network that where the simplest, most useful preventive procedures are an excellent example, I think. They don't have to be provided in an operatory. Why would you use up chair time for something that you can do in a bus or in a gym? And so, again, kind of redistributing the care and at the same time increasing the access points that patients have and families have to the system. I think then you sort of feed up into the more complex procedures if needed, and the more expensive facilities, and the higher also, professionals who are really working at their highest level of competency and legal status.
We just had last Friday, 56 dental schools just kicked about 6,000 kids out of dental kindergarten school, and they're all 25, they're all bright-eyed and bushy-tailed, and they're all excited. What would you say to one of them right now if she's listening to you thinking, well, what do you think about me going into public health dentistry? What do you think of that specialty? I'm thinking about maybe a pediatric dentist, an orthodontist. What would you say to someone who's thinking about a career in public health dentistry?
When I was teaching, I had this theory that 20% of your students are already public health practitioners. They don't need any convincing, and 20% aren't interested at all. They don't even understand that, like, making mouth guards for their kids' soccer team is public health. That's public health. I think it is. It's the 60% in the middle who are up for grabs. And so that, making sure that they understand public health, dental public health, is, I think, a challenge within dental education, because, again, it tends to be marginalized, I think, a bit. And if done right, it's hard to see. I used to have my students, when I was teaching at Tufts, I had them in their first semester of their education, and I would have them write a letter to themselves about how they were planning to practice public health after they graduate. And then I collected the letters and I would hand them out at graduation, as kind of a reminder of, you were that bright-eyed, optimistic, gonna change the world professional, or that's what you wanted to be. And here you are, and your intent is in your hands. Go for it.
So do you consider teledentistry a big part? We talked about mobile dentistry. Do you think teledentistry is going to be a big part of public health?
I do. I think teledentistry is going to be I think telehealth is going to be a big part of it should be a big part of our system. Indeed. I mean, our dental system in particular is really set up for the maximum efficiency of the dentist. It's not necessarily set up around what the patient needs. And I'm not saying that that's wrong, but we have to look at the system for what it does. Now, the folks who can get into the traditional dental delivery system are well served. The folks that are, for whatever reason, marginalized or face barriers to that system, they just don't get there. And when I know that many dental professionals feel that school-based programs undermine care. I don't necessarily agree with that, but I always say, a school-based program like ForsythKids is not a dental home. We're a dental sidewalk. So we have an opportunity to get the child into the system. Some families and some patients are going to need a sidewalk before they can climb up the front porch steps.
Yeah, I mean, the what the last generation left us, I always think is public health. I mean, when I was born, I didn't make the interstates; they were already there. I mean, there was already clean water. I already had a sewage, and so many of these people, they just slightly do something, and they think they're entitled to everything, and they don't realize that none of this would have been available if they were born on about 80% of the rest of the planet. I mean, we all need to help it get back. Now, when I think of public health dentistry, or someone listening thinks public health dentistry, does that also, I mean, we talked about FQHC, Federally Qualified Health Center, but does it also, in your mind, include like the Indian Public Health Service or prison dentistry? Is that public health dentistry to you, or not really?
I think it is. I think there are different ways to practice public health dentistry. And one way is to practice as a dental provider within a public system, like the federally qualified health centers or the Indian Health Service. I think another way to practice public health is, through the, through policy and advocacy. The Boston Public Health Commission, the Better Oral Health for Massachusetts Coalition. That's also a practice of public health. And I also do feel that, I used to say to my dental students, look, if you're going to be a general dentist, you're probably going to do a little ortho, you're probably going to do a little endo, and you're probably going to do some public health. And don't limit your definition of public health to, I have to take a trip to Zambia, the public health can happen every day within your practice. And I do believe that involvement in the community and the leadership that many dentists and other dental professionals show within their communities is a form of public health.
You just mentioned Africa. You're very involved in Africa with your options for children in Zambia. Take us through your journey. How did you end up in Zambia?
Well, it started with a dental student project, and like so many things do. And so back in 2004, took a trip there and had a connection to a physician who was practicing there. He had noticed that in the orphanages where he was seeing children, there was a lot of dental disease. Wouldn't it be great if you came over and handed out toothbrushes or something like that? Sort of again, like a lot of volunteer projects, I think we had a very typical beginning that way. And practicing public health, of course, means that you have to listen to what the community wants. And so as we got more involved in in what was going on in Zambia, it was clear that probably, coming in even to the same places, even to once a year, was not necessarily the best way to build infrastructure. And I think over time, our philosophy there has really shifted away from organizing volunteer trips to, in fact, trying to build capacity within the system that they have. And so we're very active with the dental training school there. They have a dental therapist program, dental assistants, and also laboratory techs. They do have a newish dental school that has just started in the northern part of the country. We haven't been as involved with them. Frankly, I think that the backbone system that they have of dental therapists in rural Zambia is quite good and could be strengthened, I think, to the benefit of the country and the Zambian people.
I've always told myself I want to write me a book, and I'm going to call it The Giggle Factor. The one thing that always blew my mind, I've lectured to dentists in 50 countries, and this August of I started August 4th, 1990, so I'm coming up on next year, August 4th, it'll be my 30-year anniversary. And I always thought it was bizarre. I called it the Giggle Factor. In the poorest places I've been, in several places in Africa, Asia, they're all happy and giggling. And then you go to some of the most advanced societies in the world, like New York subway, Tokyo subway, Seoul, Korea subway, and they don't seem nearly as happy. I mean, some of the happiest people I've ever seen in my life were playing in the street in Kathmandu, Nepal, Tanzania. I mean, it's like, have you ever, when you're spending your time in Zambia, do you ever sit there? Have you ever thought about that? Like, these people are really, did you ever think they were happier than the average person in Cambridge, Massachusetts?
Well, it's hard to be hungry, right? And it's hard to have to walk a long way for clean water. Those are the things that I never want to minimize the real hardship associated with it. At the same time, there's a Zambian saying that Zambians will always be carrying a smile. And it's true that they are a very joyous and I think loving and deeply grateful for everything. And I love that sense of appreciation and joy about life that I think they have more collectively than sometimes we do here, especially in our big cities.
Yeah, I just, my gosh, I thought they were so much happier. I notice it all the time. Even going down to Mexico, going down to the place we go down there. I mean, they're just incredibly happy people. I think of a lot of people in these highly advanced countries do not realize how many balls are juggling, how stressed they are. And for me, what I love the most about these missionary dentistry trips is when you just unplug out of the United States of America and you get rid of your cell phone and you just go unplug and get back down with the people. I mean, it's just my gosh, I think it's so good. You should do missionary dentistry for your own self, not to mention all the good you're doing over there. And you're doing a ton of good over there. Do you think student loan forgiveness is going to be a big part of public health dentistry moving forward?
Oh, I'm just pained at the amount of debt that our poor young colleagues are graduating with. And I don't know. I mean, I do think it will have an effect on public health unless we can find a way for student loan forgiveness and wrap that into practice in rural settings, in high need settings. Otherwise, just the absolute need to pursue a more profitable practice has to be there. It really, I think we're limiting our young colleagues' choices because of the cost of their education. Makes me very sad.
And what do you, looking back, what do you think caused the increase in price? Where do you think this come from?
Well, I mean, dental education has never been cheap, but I'm not exactly sure, to tell you the truth. It's certainly not because of the big salaries that they're paying the dental educators. But my experience sort of within, I was very active in ADIA and, the dental education groups when I was teaching. But since I've been away from that now for 15 years or so, I'm not as looped in. It really did seem to sort of take off, though, in terms of the cost, in the last 15 or 10 years.
I call this dentistry uncensored because I don't like to talk about anything everybody agrees on. I like to talk about the tough things. And I'm down here in Arizona by the border, and there's no bigger controversy than migrants. But your interest in international health began in 1988 when you were working with the Colorado Migrant Health Program. What was your experience with that like, and how did that affect your thinking with migrants and oral health?
Well, I was posted in Pueblo, Colorado. The setup, and I think that there is still a very successful program, is that the children of the migrant workers were enrolled in school. So you had 6 weeks to sort of give them everything that they could possibly get. And sometimes that was the only school that they had all year long, depending on how their family was traveling. So in addition to the normal topics that you would include, we tried to give them everything that we could in terms of the medical and dental care, eye exams, hearing. We just loaded them up. But they also had a lot of fun, which was great. It was really a terrific experience. In that community in Pueblo, many of the families had been coming back to the same farms year after year. And I could really see in the children that I treated the prevention that had started right from the beginning with the kids, was now paying off 10 years later in the fact that they were still healthy. Compare that to their parents who didn't have the same benefit. And, one night a week we would hold the adult clinic, and it was basically, they wanted everything out. You'd say, well, pick one, we don't have time to do everything. It was, the contrast was just amazing. So that really drove home the message of prevention for me. At that point, I was headed into private practice. And I do remember I had this moment where I was sort of sitting with a child and really, was just having a great time, helping them feel comfortable and really getting into it. And I thought, if I don't go into private practice, nobody is probably going to miss me. So there'll be somebody else, somebody else will be there. It's a successful practice. There's room for, somebody who wants to be in that particular situation. Maybe this would be more fun instead. And so that I kind of discovered that I had a public health head all along. Actually, Paul Casamasimo, who was my pediatric dental instructor at the University of Colorado before he went to Ohio State, I always like to remind my Ohio State colleagues that he did actually teach other places before he went to Ohio State. So I was lucky enough to have him as an instructor. And he took me out on my first school-based clinic. We went to he rounded up me and a couple of my classmates, and we went off to a school in urban Denver and did a school screening. And I had a blast. And so it's come back around to me through my connection with him in the AAPD. And of course, what I do every single day, it just makes me laugh that was how I got launched.
Your search for your name pulls up many articles on Dental Town because it's a searchable database. But I mean, you're in the news quite often. Just recently, you were in the news. 5 for Good. Forsyth Kids offers preventative dental care in school. Thousands of children benefit from free dental care throughout the Commonwealth. Is that mostly charity or government? I mean, who's financing preventative dental care in schools? Is it mostly government through state Medicaid? Is it more donations from the Forsyth Institute? Where does that money come from?
Well, in our program, it's about a third, and a third. So the Mass Health Medicaid reimbursement takes care of a portion of it. We actually receive state funding for a portion of it, and Forsyth raises the remainder. And that goes back to our original mission, to care for children.
And you're also you're so innovative. On your website, the optionsforchildren.org, you're also raising money by handcrafted sweater creations. Pieceworks Zambia, is that tied into, that's you funding the Options for Children? Am I putting that together right?
Well, you are putting it together right, although I have to say I don't have quite the same amount of time to piece those sweaters together as I used to. it's a fun thing. It basically the approach is kind of a sweater chop shop. So I studied with someone who is a fabric artist years ago. You can buy thrift store sweaters. You wash them in the washing machine, put them in the dryer. You essentially felt them, and then you can cut them up and reassemble them. So that's what Pieceworks Zambia really came from. I can't say that it ever generated a ton of money for our Zambia project, but it was certainly a lot of fun to do, and it was a great way to, it kind of gets my creative juices going.
It shows you're an artist at heart. We just had the IDF meeting in Cologne, Germany, and it's the biggest meeting in dentistry in Cologne, Germany every other year. And I always can't get over how different it is than America. Like in America, no one would want to hear from a CEO of like Colgate or Tom's of Maine or any of these companies that you worked in the past because they're selling something for a profit. So they always want to listen from a dentist who doesn't know half of what this company knows about their product. But then when you go to the IDS meeting in Cologne, all the dentists there, they want to talk to the owner of the company. And if you're like, well, hey, I'm a speaker, I'm a middleman intermediary of information. I mean, like when I go to 3M, I have to go to 3M in Minnesota all the time because my sister is in a nunnery up the street in Lake Elmo, so I have to go somewhere for 4 hours and 1 minute to make it a tax expense. And you would talk to all these PhDs in organic chemistry. And then I would tell them what, people were saying on the lecture circuit. And they would just, they didn't know if they wanted to cry or throw up. I mean, it was just so stressful, the misinformation. But dentists always say, well, those guys are making money. It's like, well, what are you, a volunteer? I mean, some lady comes off the street and you tell her you got 4 cavities. How's she supposed to know if that's true or not? And she's trusting you. And so why your patients have to trust you because they would know a cavity from a root canal. And the dentists in Europe trust dental manufacturers and they want to talk to the top dog. You've worked with these companies that are for profit, Colgate, Tom's of Maine. I love working with the value chain. I mean, I've never gone to a dental company like Colgate. Who's the Greek guy? Foti
Panagakis.
Oh, I mean, the guy's got 2 doctorates. I mean, if you spend an hour eating lunch with him at Colgate, if you raise your IQ 3 points. What advice would you have to these young kids coming out of dental garden when interacting with these big companies? What has your experience been with them?
Well, I'm an industry champion. I enjoyed working for Colgate. I enjoyed working for Tom's of Maine. Colgate then purchased Tom's of Maine. I don't know what kind of karma I have about Colgate, but obviously I'm still working for it. But both great companies, and also because of the manufacturing standards around the products that they made, it was very easy for me to sell what they had. I thought that they were both really impeccable in how they approached their quality control. And of course, they have some help from the government in keeping that quality control up. But I'm a very strong proponent of both of those companies and the products that they sell. I have to tell you, we were talking about fluoride earlier. When I worked for Tom's of Maine, they make products. They make toothpaste without fluoride, and they make toothpaste with fluoride. And we figured that if we were getting calls in the customer service center saying, why the heck are you making toothpaste with fluoride? And then, about the same number of calls saying, why the heck are you making toothpaste without fluoride? That we were doing it about right.
Yeah. So the crazies on both ends are probably the same. But you know what? I always tell these dentists, look, because I used to, I've said this a million times. When I was a little kid, I had 5 sisters and a brother, and our vacations were always go to some big theme park, Six Flags over somewhere. And then Dad always stopped at a place to watch us make something. Like when we ordered our new family station wagon, we drove to Detroit. A golf cart pulled us on a deal, and we got to follow our car from start to end. He took us to Coors, all these different places. And I always had that love of seeing all the dental manufacturers. My 4 boys have been to probably 100 dental manufacturing plants in 30 different countries. Love it. I used to have a one each month introducing your value chain to the dentist, and then we had to stop it because there was like, why do you have these people selling stuff? And and it's like, dude, you sell stuff. Why is it so emotional? Why is healthcare emotional? Why is a dental manufacturer emotional? I mean, sometimes I think I'm the only normal person on the entire planet. But Colgate, I mean, what a legend in dentistry. You go around the world, half the countries don't even have a word for toothpaste. It's called Colgate. Just like you'll say, hand me a Kleenex, and it wasn't a Kleenex. You'll say, make me a Xerox copy, and they're on a Canon printer. I mean, Colgate was so amazing, there's not even a word for toothpaste in half the countries. And what I would recommend is that when you're on vacation, number one, you make it a tax expense. I mean, if you're there 4 hours and 1 minute, but if you walk into any of these dental companies and you're a dentist, they treat you like royalty. But when you get to see, feel, touch the manufacturing of a bonding agent, an impression material, tube of toothpaste, it shows you that show, touch, feels how you educate children. I mean, it is just, there's so many products I will never think about the same because I actually went in there. And then you find out that the people that own the company and the people that work there are just as passionate as you are. And they all see themselves on the same team fighting oral health decay. And everybody gets it except my homies. I mean, I don't get it. So I can't believe we went over an hour. Are there any, I mean, you could talk forever. Is there any things that you wish I would have asked that I was too dumb to not ask?
Well, I think you've been very thorough. And I have thoroughly enjoyed our conversation. So we could do this for the next 24 hours and we'd still be going at it.
Well, I would love, I'm actually a dental journalist because I've owned a magazine since 94. I've had a monthly column 94 to 2018. And you get 2 feet of stuff sent to you every month and you're going to publish 3 or 4 things. But if you yourself, anybody in public health, I mean, I always tell my editorial team, we have way too much stuff on root canals, fillings, and crowns. And public health, like I say, I started it off with public health. It's like the redheaded stepchild of dentistry. I mean, it's like, she should be, she's just, it's overlooked, anything on public health. And then just for selfish reasons for myself, you have so many connections with Harvard and Forsyth and all those fancy universities. Could I bribe you to get any of my 5 grandchildren into college? Do you have a program that I could, I hear it's a new rage now to get into these fancy schools. I just got to find someone and give them money.
That's exactly what you have to do. Find someone and give them money.
Maybe that should be your new Peace Works for Zambia. You should just start taking bribes to get rich dentist kids into your fancy schools and then just channel all the money to your options for children in Zambia.
Yeah, kind of that Hood approach.
Well, hey, thank you for coming on the show. Thank you for your love for public health. Thank you for all that. When I read about your career, I mean, it's just amazing. I'd have to live to be about 690 to do everything that you've done, but seriously, thank you so much for coming on the show. And then I want you to email Denise Kasbaum and say, oh, I went on the show and you're still stalling. You're too busy, Denise. She would be a great follow-up to you. But thanks for all you've done in dentistry. My last question is, what would your advice be to all these kids that just left school last Friday, bright-eyed and bushy-tailed? What would you say to them? What would your final advice be?
I would say, find the way to practice dentistry that makes your heart sing. And the rest of it is going to take care of itself.
Truer words never spoken. That is obvious. Thank you so much for coming on the show.
Thank you, Howard. It's delightful.